This next panel is really central to what we're doing. I think that in some ways the hardest task that we're going to be faced with is narrowing down for all of the things that we need to do to reduce the barriers to economic stability for children in poverty in California. The hardest thing we're going to have to do is to narrow down those recommendations to the couple things we're going to focus on in the near term to get done immediately. And in thinking about what those recommendations are going to be, I think the whole area of early intervention and support has got to be one of them. And so this panel is really critical. It's a magnificent panel, and I think there's no one better to moderate it than Robert Greene. He's an editorial writer for the Los Angeles Times, a member of the editorial board, and he covers the area of California and Los Angeles government, politics, policy, and law. A tremendously thoughtful journalist, whether sometimes we all hate the editorial positions of the Times, and this is a time to criticize him for it, I guess. But enormously thoughtful, and I think the other thing that those of us who are attorneys make us think very highly of Robert Greene is that he's a graduate of SC and then Georgetown Law School. He graduated from the practice of law to become a journalist, so we're enormously grateful. Robert Greene and the panel.
Thank you so much, Conway. I appreciate it. We'll get right to it. I'd like to introduce you to this really amazing panel. A lot of folks ask, what on earth do, all right, my mother asked me, what on earth do editorial writers do? And what I tell her, quite honestly, is that we form opinions based on what we hear from people who are at the top of their field. And so in service to children, we certainly have some of the best here with us this afternoon. And so I will, starting at the end, of course, is, California Superintendent of Public Instruction, Tom Torlakson. Tom Torlakson is currently in the third year of his term. You know what that means. He will be busy next June. He has a great deal of experience and expertise in policy, in education, and in child poverty from his tenure in the state legislature. And as you may know, he was a teacher and a high school coach as well. And we have next to the superintendent, Dixon Slingerland, who is the executive director of the Youth Policy Institute, and has been so since 1996. The Youth Policy Institute, you may be familiar with, devotes itself to the education, technology, and training, and really turning around neighborhoods. And I hope that in the course of this conversation, we're going to be able to hear a little bit about the Promise Neighborhood Grant that the Youth Policy Institute is involved in 2 neighborhoods in Los Angeles. And we are very pleased to have Martine Singer. Para Los Niños. Martine is the president and CEO of Para Los Niños, became so last year after a long career in a variety of fields, including service to children and the community in Los Angeles. And right next to me we have Jim Mangia, the president and CEO of St. John's. I always say Child Well, that doesn't work. St. John's Well Child and Family Center. St. John's, as you may know, offers free and low-cost, high-quality healthcare, medical, dental, mental health care to, can you believe this, 160,000 folks in the South Los Angeles area. So please join me in welcoming them this afternoon to this panel. I want to, if I could, start out with a question for Jim Mangia. We've heard a lot, and we've been talking a lot about how the United States in general, California in particular, is emerging now from this recession period. Can we call it a recovery? It's certainly not a full recovery. We've heard earlier today about how the child poverty situation in Los Angeles is still far worse than it was before the recession. Maybe that means that the recovery isn't complete, or maybe it means that we've just ended up in a different place. And I want to ask you, Jim, how do you see the situation differently today than, say, in 2007? Doing what you do, serving kids who otherwise wouldn't have the access that they need to high-quality medical care. Is it just a matter of more folks who need it, or is it a different type of family that you're seeing?
Well, just in the last year and a half, 2 years, we've seen a 43% increase in our patient volume at the St. John's clinics. So we've seen tens of thousands of folks who are in need of free healthcare services. I think the other dynamic that we see is that we're seeing patients that are with much more complicated, not only complicated diseases, but complicated social situations, where it's a family that's living in slum housing, we're pulling cockroaches out of the ears of a dozen children a week, that have rat bites on their legs, and their mom has diabetes and doesn't have access to medication, that they're food insecure, that there's no parks for them to play in, that there's no fresh fruit and vegetables to purchase in South LA. I mean, there's just one, what we call in public health social determinant after another that besieges our families. And so the question is, how can a community health center provide these kinds of wraparound services to engage these social determinants? And I think it's through these kinds of partnerships with other organizations that focus on other aspects of it. But what we've seen since the recession is both a large increase in historically middle-class families who are now coming to St. John's Health Centers, but also an increasingly complex and difficult set of patients, families, who have a myriad of issues that are affecting them.
And let me ask the other panelists, leaping off from that point. Is this something, given your experience working with folks dealing with poverty in Los Angeles in the past, and seeing the ups and downs of the economy, is this something that once it happens, the population grows that you're serving, you see more folks in the formerly middle-class communities? Is that something that abates after a few years and the economy improves and hopefully employment improves? Or is the entire dynamic now different? Either Dixon or Martine or Superintendent, if you'd like to jump in.
I think in the communities that we're focused on, which are particularly Hollywood, Pacoima, and Pico Union, sort of the hardcore, very low income, high poverty families, that stays pretty constant. And so you might see some fluctuation in between sort of, let's say, the middle class, lower middle class, depending on the economy, but sort of these hardcore issues we're dealing with don't change much. And that's in our case why we've taken the approach of a place-based initiative to come at this from a sense of how do you saturate a community with resources.
And place-based, are you talking about specifically your promise neighborhoods, Pacoima and Hollywood? Or are you talking further than that?
So further than that, though that's sort of a signature program for us, Promise Neighborhoods. But in these three communities of Hollywood, Pacoima, and Pico Union, where we've tried to really bring together every conceivable resource to support youth and families around supporting the schools, supporting the families outside of the schools, and providing the wraparound supports. And so we were lucky to get a $30 million implementation grant from the feds this past December for Promise Neighborhoods. We were just awarded a Choice Neighborhoods Planning Grant, which is the president's signature housing program. And then we also were thrilled to receive the Byrne Criminal Justice Grant, which is the third that the mayor mentioned in his speech at lunch, the third leg of the president's neighborhood revitalization initiative. So to have all three happening in Los Angeles, number one, is really exciting. But number two, allows us in these particular places like Hollywood and Pacoima to layer these resources to try to do really a comprehensive solution to poverty and to child poverty.
And while there's new optimism with the Prop 30 money coming in and that investment really showing itself. We've had a great increase in free and reduced lunch students. We have a number of the students who are drifting and needing help because a lot of the social service network has been dismantled. We're still 49th in the nation in per pupil spending, which is a disgrace for a state with all of our capabilities. And counselors are less, classes are more crowded. So we have a daunting challenge along with this optimism and the potential of the team that you're pulling together here. But it's some heavy lifting to go. Just early learning is one example. We used to serve 500,000 students in the state-run preschools and childcare. We're now down to 270,000. So we had $1 billion lost that has not yet been restored in our own state budget for early learning, which we know is enormously helpful to helping end poverty.
So, Martine, let me ask you, as you're dealing with the families with whom you work at Para los Niños, are you finding that they're basically the same population that was coming to Para los Niños before, or have things shifted because of the change in both the economy and demographics?
I would say, like Dixon, we're working also in Pico Union, in the Skid Row area, in South LA, in Watts and Compton, and in East LA, and we're dealing with some pretty entrenched communities of poverty, really the poorest communities in the county. So I don't think there's been a great fluctuation since before the recession.
What's your best? What have you found is the best tool, the most effective program that you've had that you want to share your success with others? And then I want to ask you afterwards, and what do you need to make it better?
Okay. Well, the approach that we've developed is really one that helps children learn, and that's the simplest way to put it. They obviously can't learn when they're hungry. They obviously can't learn when they don't speak English and the instruction is in English.
So you run charter schools, but you start with kids from what, 6 weeks old?
Yeah, we have preschools that serve children 6 weeks to just pre-kindergarten. There's about 600 and some kids in those schools. And then we have right now about 1,500 kids in charter schools as well. And then we have a variety of other family supportive programs, mental health and family preservation that support those children and families. And what our model really is it stems from this really, really grim fact. And I think Kim Belche alluded to it earlier. If children can't read by the end of 3rd grade, we all know that that does not bode well for their future. They're much higher likelihood of dropping out of high school, of having poor outcomes in terms of health, income, incarceration, et cetera, et cetera. So it really is our job, all of us as educators, to make sure that children read proficiently by the end of 3rd grade. And when you look at the statistics for California, and Superintendent, correct me if I'm wrong, but I believe the number is that 85% of low-income children in California cannot read by the end of 3rd grade. I think we've all just accepted that this is, you talk about the pipeline, to prison, I think we've all just accepted that without knowing it. We've all accepted the fact that 85% of kids can't read by the end of 3rd grade. And when you come to English learners, which is primarily the group that we serve, we don't only serve Latino families just because our name is Para los Niños, but it happens to be the predominant population in our communities that we serve, the number goes to 95%. So we're saying it's okay for 95% of children who don't come to school speaking English to fail. And that's just not acceptable. So we've developed a kind of a curriculum that's based on the arts, that's project-based learning and constructivist in nature. But more importantly, I think even than what goes on in the classrooms is there's 2 other components. One is having, as Dixon described, the services and supports available at the school sites. So we have therapists. It's very much the community school model. It's been called different things, but we have therapists and social workers and parent advocates on site, on staff, supporting the families, so that when a problem occurs, they're not just saying, here's a card and go take 4 buses to see Jim 2 weeks from Thursday at 2:30 in the afternoon. We're saying, Jim, he was at the basketball game last night and he gave that workshop on bullying. Well, he could help your child. Well, you talk about, getting people enrolled in services. They are much more likely to be engaged when the person delivering the services is a member of their school community. So that's a huge piece of it. And the other piece is parent engagement. And not just parents joining the PTA or whatever we in this room might consider to be parent engagement, but truly understanding the nature of the families that we serve, many of whom are not literate themselves, may not speak English, may not have graduated beyond the 5th grade, depending on which country they've immigrated from, but who are really not comfortable in a school setting. They do not feel comfortable around authority figures, even if our teachers, as they are primarily Latino and Latina. There's a big bridge there. And so we find that if we engage families successfully, we help them understand, as the polls showed, they all want their kids to go to college. There's not one that doesn't want their child to succeed. They just don't always know how to help their child learn, to help their child be successful in school. And I really think those 3 components, the education with the services and the parent engagement, are what's successful. And if I could just add one thing, I think the other important thing, and various people up here have alluded to it, is the issue of income. That you cannot look at child poverty by itself. You have to look at the income of the family in which the child lives in a family, no matter whether it's a foster family, the biological parents, grandparents, they live in a family. And you cannot separate the conditions and the outcomes from that child from the conditions and the outcomes for the parents, even though the parents are not as cute or gap-toothed smile. I mean, people like to support and give money to children. They don't like to support and give money to poor adults. And so what we need to do is make sure that we're increasing the income of the parents at the same time as helping the children. And so one of the things we're looking at is starting a program where we can actually engage the parents in becoming teachers in our preschools and have services on site, have courses on site for them to become teachers and raise their income level, so that we're approaching it from it's called a 2-generation strategy, but I think that's a really critical point. You cannot help one without the other.
So, Tom, I see you nodding. Let me ask you, from your perspective, leading the schools in the state of California, what kind of issues do you run into with getting parents involved? It's a simple thing to say, and I know a not very simple thing to actually accomplish, especially when you're talking about families in poverty. If people are working, they're not available. If people are not working, there's often a level of despair. What do you find, and what do you do about it?
It's a challenge. Working parents, working 2 jobs, taking a bus, getting up at 5 in the morning and riding an hour to work at a hotel or a restaurant. So we understand that. There are programs that are exemplary that we're saying are role model programs. So one of our keen focuses is on the idea of how do we share the best practices. So we're going to do this on a website. We're going to do this through training. I think, again, we have to start, if education is a key to escaping poverty, we have to start when? As early as possible, and that's with the parents and with the students. So preschool, to me, is a major poverty buster. Should we not have preschool for all 4-year-olds and 3-year-olds in California? I think we should. I recently traveled to Peru. 53% of the students in Peru go to, of 3rd grade, 3-year-olds and 4-year-olds get preschool. But if they can do it there, we can do it in California. But I do believe that we have to start early and have the parents learn when they can. It may be a Saturday workshop, it may be a fiesta lunch gathering, and turning the TV off, finding a quiet place in crowded apartments with not much space, helping the students do their homework, role modeling reading, or if you don't read, just have some books at home. So we're finding there's a number of programs that really work. PK has some programs, Head Start has some programs. There's a conference coming up by the African American Administrators of California in March, which will be focusing on parent involvement. That's one of my big priorities, is how to increase that across all age span.
Jim, you talked about the social determinants that affect your clients. Could you talk a little bit about how, from your perspective at the clinics in trying to deal with the health challenges that they bring to you, what do you do when you realize, when your clinicians, your doctors, your nurses realize that the problem here is not necessarily a medical problem, but a housing problem, or a crime problem, or any one of the other many things that you have to deal with? I mean, you've all been talking about a sort of ideal where you would do wraparound services where you bring everything under one roof, How real is that? How well can that work?
I think it works very well. I mean, the first thing you have to do, obviously, is, particularly with physicians, is to get them to recognize that there are things that impact health other than a germ or a specific disease. So once you win that battle and you organize the physicians to be part of a comprehensive and holistic solution, then you can begin to address these social determinants. So for example, with the question of slum housing, in South Los Angeles, 80% of the housing is substandard. Most of it was built before 1978. Lead paint was not outlawed in the United States until 1978. So particularly when you're in substandard housing where you have degrading paint, you have dust, kids are crawling on the floor, they're pulling themselves up on the windowsills, they're putting their fingers in their mouth, and they're getting lead poisoned. We know the impact of lead poisoning on the cognitive development of a child. And so we, 25 to 28% of the kids that we test for lead have elevated blood lead levels. And so what can we do about that? So what we did is we developed a program, which we called Healthy Homes, Healthy Kids, where we train community health promoters to actually go into the home, do environmental health assessments, teach the families how to use low-cost, low-tech barriers to reduce some of the slum housing conditions, boric acid. We developed a HEPA vacuum loan program and so on. But then you also have to do organizing, and you have to organize the tenants to engage with the landlords to force them to make the kind of structural repairs that are necessary. And we've seen in this program, which impacted 4,000 families, we've seen a 95% reduction in blood lead levels and 100% reduction in asthma hospitalization. So these kinds of wraparound, comprehensive, coordinated programs can work, but you can't just, I think the thing that I think I've learned the most from being at St. John's and providing healthcare services to so many families is that health is much, much more than handing someone a pill. It's the whole myriad of things that impact the family's health, whether that's a lack of parks, the lack of a decent living wage job, the lack of healthy housing. I mean, all of those things dramatically impact the health of a child and the family.
As our panelists are talking, I realize that there is something that a lot of the folks, maybe most of the folks in this room, know quite well that you might be surprised would come as a surprise to many of the rest of us. And that is when you're in the field of providing a service to communities in need, the line between service providing and activism, community organizing, isn't necessarily visible or doesn't necessarily exist at all. First, Dixon, let me ask you, if I could, the degree to which you find in your organization there is a level of, well, let me put it differently. What kind of engagement do you have to do to get folks involved in order to be able to deliver the services that you have to deliver?
Yeah, no, it's absolutely critical. And I think what you're hearing from all of us is that there is no silver bullet program to turning around communities to fighting poverty. You have to do everything. And one of the things you have to do is community engagement. So when we first got the Promised Neighborhoods Planning Grant back in 2010, we spent 18 months working with the communities of Hollywood and Pacoima, doing thousands of surveys, going door to door, really sort of activating residents, hiring residents as promoters to work with us to help get the word out to the community. So it's working through schools, it's working directly with families in their homes, it's working through community centers. And you have to do all that work really to lay the foundation for the programs that then come, because resident buy-in is absolutely critical to the success of these efforts. Promised Neighborhoods is cradle to college and career. So it's the whole pipeline. And so you've got to deal with the 0 to 5 years, and kids got to be ready for kindergarten. You've got to have high quality schools, K through 12, and you've got to have kids graduate high school, college, and career ready. And so to get to the point where you can even have a pipeline like that, serving 19,000 kids in our case, you've got to have that baseline of community engagement.
What would you expect is the level of knowledge of the public generally? And by the public, I mean people who vote, people who might decide that they have some money to contribute to a worthy cause, but they want it to be effective. They're not quite sure where it should go. What's the level that you believe is the understanding of the public generally about the level of need in California in poverty? Would people be surprised to know that so many children in California live in poverty? Superintendent?
Yes, I think they would be surprised. 1 million children who are trying to get undercovered California don't have health care, and that's unthinkable to most of the voting part of California. A large portion of the voters in California don't have kids in school. There's a surge coming now of more and more of those voters who have grandkids coming into our schools, and they're visiting the schools and seeing it firsthand. But the average voter in California is not connected to our public schools and doesn't see that poverty firsthand.
And does that manifest itself in our policies? How tight is that link between that lack of awareness and the votes that you and your colleagues took when you were in the legislature and that go on today?
That's why we're all here, and why it's such a great opportunity to have a springboard for a call to action, because that doesn't happen just by itself. And the poorest, those that are without work, those that are at low-wage jobs, they don't have a voice. They often don't have time to attend the PTA meetings, and if they do, there may not be an interpreter to help them understand what they can do. So I think it's a major challenge for us that's all about this conference. How do we change that? And it's even more important now that we have the local control funding formula, because we talk about now billions of dollars that will be shifted to high poverty communities. This is an historic change that came from the governor's leadership and the legislature working together. And so this year, $2 billion more will be available in high poverty communities with high portions of English learners. And it's key to have parent involvement. It's key to have the community involvement. It's key to bring around all the service agencies so we can make sure that that money is well invested by every school board in the state.
And then what happens in those communities in distress where parents don't have the awareness or the time or whatever it is that they need that parents in other communities are going to have to be able to write letters, attend meetings, participate in the process and say, this is what we want?
I think it's up to us collectively, and Dixon gave a great example of community outreach workers in the language of the neighborhood, working with parents to give them an opportunity. As you said, every parent wants their child to succeed, and we have to connect that desire to the opportunities that are here.
Let me ask you the magic wand question. This is sort of typical of these kinds of panels, but sometimes they can be useful. And let me preface it by saying that we heard from Mayor Garcetti earlier today. I think it was it Congresswoman Bass who said that he's been in office all of 5 minutes? Maybe it was someone else. You know, of course, that this coming year, Los Angeles County, largest county in the state, is going to be electing 2 new members of the Board of Supervisors for the first time in a long time. We are emerging, I hope, slowly, I hope surely, out of recession and into recovery. This is an interesting time politically as well as economically if you had a magic wand, but it wasn't loaded. It only gave you one wish. You could tap one political body, or the mayor, the Board of Supervisors, the state legislature, and you could get one practice out of some county department, or one policy changed out of the legislature. What would it be?
Is that for all of us?
Yes.
I would, if I can go first.
Sure.
I would create a coverage vehicle for the undocumented to make sure that every person living in Los Angeles County, regardless of their immigration status, would have access to healthcare services. Obamacare for all.
So you're looking at the Affordable Care Act, and you're looking at that whole, which is going to continue to provide you with clients in need. Okay, great. Martine?
Well, I mean, I couldn't agree more with Jim's, because the buck always stops with undocumented families. The public funding just does not cover them, and it's the first thing to go. So I don't know. I'm going to let Dixon go while I think about what I'm going to use my wand for.
Oh,
I can't use it for 3 wishes.
No, sorry. And you cannot wish for more wishes. That's one of the basic laws.
So I'm going to preface it with, I don't need a magic wand for some things, because we've got a fantastic mayor, as you heard, who really believes in this kind of work and understands it. He championed things like the Family Source Center system when he was president of City Council. So we don't need the wand for him. We've got a great state superintendent in Tom Torlakson who really gets this stuff. We've got Superintendent Daisy here with the school district, who's been a champion of work like Promised Neighborhoods. So we really have great leadership. It's one of the reasons I'm so excited about this moment in LA. People who not only are aware that things like this are going on, but really understand and buy into them. So I'm going to use mine in a very crass way, which is, as the mayor mentioned, we're waiting to hear whether the White House gives LA a promise zone, which we might find out this week. So that's what I'm going to use my wand for.
And best of luck on that.
Aside from the desire to see universal preschool, I think the whole idea of teamwork, where you get the county, the local community, neighborhood council, the city teaming up. Chronic absenteeism is just one example. You can have the best facilities, but if students aren't there, and that's where we need social services, because they may not be there because grandma's in a wheelchair and needs someone to watch grandma. There's a younger sister, older brother has to stay home. 10% of our students in various parts of Los Angeles are chronically absent. So it would be to see more teamwork where the new Board of Supervisors gets a focus on these poverty goals and issues and teams up with the schools and teams up with great programs like the Promised Neighborhoods.
And before we go back to Martine, which I do want to do, let me ask you about that teamwork. I know everybody hates the word. In fact, one of our panelists mentioned it earlier this week. Don't use the word silo. So I won't use the word silo. But we know that there is a communication problem. There's a problem in working together between government agencies, not just government agencies in the nonprofit sector, but between government agencies. They don't even know how to talk to each other. So Superintendent Torlakson, I acknowledge I gave you the wand, but help it out just a little bit, if you could, by explaining what it is that government agencies can do to work better, not only with the nonprofit community, not only with service providers, but with each other. And to know how to do that, I guess we'd have to figure out, why is there such a deep problem in the first place?
There are silos. I said the word. I'll give one example. We recently met with Mayor Garcetti because the jobs creation money, the career pathways money that Darrell Steinberg got in the budget, we said, how could we partner with you, Mr. Mayor, with the city, and how could you help us reach employers? Because we need places where young people can go and get mentorships. So it's reaching out and forging at the ground level those kind of partnerships. And in the case of helping kids in poverty make sure they can attend school, is there an abuse problem in the home? It's having a close working relationship with those county workers and those other agencies.
Martine, there's a wand that's burning a hole in our pockets.
Okay, well, I guess what I would use it for is to advocate for some flexibility in spending government funds. You know, I'm all for accountability, and we certainly hold ourselves to very high standards, and we spend half our time writing reports about what we did and showing our outcomes, which is all good. But there needs to be some degree of flexibility in government spending. In order to help a family, for instance, you know, you're dealing with a child's mental health problem under Medi-Cal, you cannot help the parents. How do you get mental health services to these parents who are part of this family system that the child is living in? Your hands are tied. How do you help them with rent? You can't, you know, you can't talk about therapy on an empty stomach when they're at risk of being evicted. So there has to be something built in that allows for discretionary spending on the part of the service provider.
Thank you. So some of you had some questions, and I am going through them. I'll use a little bit of a journalistic license to rephrase just a little bit. We've been talking actually all day about some of the roadblocks, some put up just naturally by the economy, some almost intentionally by government to getting your work done. One of the new requirements that a lot of folks in the service sector, the service providing sector in the nonprofit communities seem to have encountered has to do with data. That you have directives from government that tell you, we want to know that this is working. We want to know, you can probably recite these things together, not just the words best practices, but evidence-based, and you know the routine. I want to ask you, is that helpful? Is that purely harmful? Is there a way to make it into something other than just a roadblock? Dixon, do you find yourself with additional mandates from government to keep tabs of data and to do analyses that show that there is a good bang for the buck, if you'll pardon the expression?
Yeah, so I'd say two parts to that. One is that data is absolutely critical. You have to have data-driven decision-making in this kind of work in the community. And so in Promised Neighborhoods, we've got 23 indicators we're tracking across 10 outcomes. And everything we do is about making progress on those 23 indicators. And we have a fantastic data system for tracking it. So that's really important. I think the challenging side of it is when you've got all these different data requirements from different funding sources. And so that's where we need the systems change work, the work with the public sector around how do we align these programs around common outcomes. So when we're doing work with families or doing job development work in a work source center or work with youth in a youth source center, how are we doing all of this around, whether it's the 23 Promised Neighborhood indicators or whatever they might be, so that this is aligned work and the public sector has aligned their systems to best support what's going on at the ground level.
And data is going to be really important as community groups and advocates appear before each school board in the state in 1,100 districts to determine how best to spend the money. Having evidence-based, outcome-based understandings of the effectiveness of these programs will make a difference in what those board members decide to do with $2 billion extra they have this year, and it's going to go all the way up to $8 billion per year additional funds that are targeted for the population people were speaking of. So I agree with Dixon that you need to have measurable outcomes. Just the fact that we started measuring graduation rates and dropout rates, we've seen a very targeted emphasis by schools to help young men and women succeed and graduate.
So I'm not hearing any of you say that new requirements from government programs that you track data and that you present evidence is in any way a roadblock to your getting done what you need to get done.
No.
Okay, I'm pleasantly surprised to hear that. Great. This is a question from our audience, Jim, for you. You were talking about a 40% increase in demand for your services in the last 2 years. So the question is whether you've been able to expand your capacity, or is there really that much more demand than you have capacity to provide services for?
There's always more demand than we have capacity, but one of the beauties of the Affordable Care Act was a $12 billion investment in the expansion of community health centers. And St. John's took great advantage of those competitive funding opportunities, received $10 million to triple our exam space at our Hoover and Slauson site, built 3 new school-based clinics with Obamacare money, renovated and expanded our Compton facility with Obamacare money, and have since received several operating grants under the Affordable Care Act expansion. So there was a tremendous amount of investment leading up to 2014 in the Affordable Care Act for the expansion of primary care, particularly community health centers, federally qualified health centers, and school-based clinics. And so we were ready. We were ready. As well as tremendous investment by the federal government in outreach and enrollment funding. So we were able to hire benefits counselors and outreach enrollers. We've, just St. John's alone have enrolled more than 12,000 folks into health insurance in the last year.
Thank you. So I have a question that I'm hoping that each of you will address, but Jim, maybe it's actually most in your bailiwick. The Medicare law, 1965 law, excludes incarcerated children from health benefits. That's one of the things that we've dealt with on the Times editorial page when we're talking about how to get the best medical care that's available to the folks who are going to be coming out of prison. Can't you start it when they are incarcerated? And there's all kinds of problems with that. Jim, let me ask you that, but I want to invite all the other panelists to jump in as well. I mean, the question is not really a question; it's please comment. But let me sort of direct it by saying, is there anything we can do about that other than changing the law?
Well, I think yes and no. Obviously, the law needs to be changed. I think the beauty of community health centers is that we can see anyone, regardless of their ability to pay or their insurance status, and we're required to. And so we see a lot of folks formerly incarcerated who are not eligible for particular benefits at St. John's and at community health centers throughout the state and throughout the country. So I think when you have a nonprofit healthcare system, which community health centers provide care to more than 8 million Californians a year, you have more access than when you have an exclusively for-profit healthcare system. And federally qualified health centers as nonprofits will provide that care.
Please, Martine.
I can add, even though Medi-Cal locks you out, and speaking of the youth population, not the adults, it locks you out of the juvenile halls and the camps, you can serve the kids who've been adjudicated. And at my last agency, we had a very successful program using therapeutic behavioral services with children who were young people who had served their time, but they are still in the camps and they are still in juvenile hall because they cannot be placed, because they're former foster youth, they've crossed over to the delinquency courts, and they literally have no place to go, supposedly because of their behaviors, but who created the behaviors? So we work very successfully with them, and that is a little slice of the population that you can work with to get them out of there, because they're really being held in an unconstitutional way in a jail setting when they've already done their time.
There are some other questions that I have, and I know that all of you have, but we are pretty much out of time for this panel. I want to thank very much, and hope you'll join me in thanking our panelists for participating in this session.